Did your water break or did you pee a little? I promise that you are not the first pregnant woman to ask that question. As a labor and delivery nurse, I can tell you this is one of the most common reasons people come into the hospital. So in this video, I'm going to explain if your water actually broke, well, at least some of the ways that you're able to tell, what it may feel like, and going into the hospital to get checked out. Hey everybody, I'm a labor and delivery nurse, and I want to welcome you to the labor room. If you are pregnant or preparing for delivery, this channel is for you. I want to help you understand some of the things you might experience during the labor process. Today, we are going to talk about one of the biggest questions that we have in labor and delivery. Did my water break? So first, let's talk about what your water actually is. Your baby is inside essentially a bag that we call the amniotic sac, and it's filled with amniotic fluid that protects your baby. The fluid in the beginning is produced by the mother, but then later on it's produced by the baby. And it's mostly made up of the baby's urine. So when people say my water broke, they're talking about that sac rupturing and the fluid leaking out of it. But there's something that people don't realize. Only a small amount of people have their water break before labor actually starts. Most people are already in labor and then their water breaks. You know how in the movies, when somebody's water breaks, all of a sudden there's a big gush of fluid on the floor and they're standing in like a puddle? Don't get me wrong, that can happen, but it's not the most common way. Sometimes there's a big gush, but it's followed by a slow leak or like a small trickle. And sometimes there's no gush at all, and you just may have that slow leak or that trickle that just keeps coming. Here are some things that might mean your water's broken. That sudden gush of fluid. So you might feel a big gush that either soaks your underwear or just runs down your leg. A constant trickle. Sometimes it's not very dramatic at all. You might just keep getting this constant trickle that just keeps coming that you can't control. And you're like wondering, where's all of this fluid coming from? Fluid that does not smell like urine. Amniotic fluid usually does not smell like urine. Patients sometimes describe it as like a sweet odor, or they just say it's odorless. Another sign is if you keep soaking pads. So if you first notice that maybe your underwear are wet and you decide, hey, let me put on a pad, but you notice that you're having to constantly change it and it just keeps coming out, your water might be broken. And lastly, it can happen with movements. So if you notice the fluid more when you change positions, either you go from standing to sitting or you turn from one side to the other, then that's another sign. But pregnancy also comes with a lot of normal discharge and a lot of pelvic pressure. So that's where things can get a bit confusing. A few things that could mimic your water breaking is urine leakage, extra discharge, increased mucus, and sweating. If you think your water broke, always call your provider or go to labor and delivery to get checked out. If you feel it's broken, you should always go. But you should definitely go if the fluid is green or brown, if you feel that your baby isn't moving around as much as it usually is. We call that decreased fetal movement. If you're not full term, or if the fluid just continues to leak and you just don't know what's going on. I do realize and I understand that if your water breaks, there's a lot going on and there's a lot going through your mind. But try to note the time that it broke and the color of the fluid. Those key factors are really important for your providers to know. When you come into labor and delivery, we do have a few ways to check to see if your water is actually broken or not. Some providers might do a speculum exam, but then they might take a sample of your amniotic fluid and swab it with a test strip, or even send that sample down to the lab. And then other providers might look under the microscope. All these tests are just to confirm whether it's amniotic fluid or if it's something else. Now, if your water is indeed broken, the next steps depend on how far along you are, how your baby's doing, and if you're contracting or not. So if you're wondering if my water broke, trust me, you're not alone. You might as well go in and get checked out. Your providers rather you go in and make sure everything is okay than you sitting at home unsure and worried. If this video helped you understand signs of your water breaking, go ahead and hit that subscribe button. And let me know in the comments, did your water break before labor or during labor? Or did it not break at all and your provider had to break it for you?